These cancer patients wanted to get rid of their breasts for good. Their doctors had up. That's when she got mad. Set the world on fire levels of mad. Bowles, a stage 3 breast cancer survivor, had just undergone double mastectomy surgery and had told her surgeon to make her flat, that is, do not reconstruct her breasts. No implants. My surgeon unilaterally decided to go against what I had consented to while I was on the operating room table. This year, 266,000 new cases of invasive breast cancer, as estimated by the American Cancer Society, and more than 100,000 women will undergo a mastectomy to treat or prevent cancer. Although women roughly 25% of double mastectomy patients and 50% of single mastectomy patients opt out of reconstruction, published in the Journal of Clinical Oncology. Many women do it, but while women have begun to, the only thing doctors seem to be rejecting is their patients' wishes. In my research I've found that many women are completely surprised at the outcomes when they come out of surgery, says Gail Sulik, PhD, founder of the Breast Cancer Consortium and author of Not only have doctors reportedly urged patients to reconstruct without even discussing the option of going flat, some women say that they've woken up to find that their surgeon left them with extra skin in case they change their minds and want to build a breast, later commonly referred to as a skin-sparing mastectomy. If confronted, Bowles had always had a complicated relationship with her breasts. She grew up trying. Everything was harder with boobs that size, she says. When I swam, to go from that to flat may seem extreme. But not for Bowles. 5 months after her diagnosis, in 2016, chemotherapy had melted the golf ball-size lump in her right breast, and after doing substantial research, she decided she wanted to go flat. She believed that I was ready to let my breasts go and was actually happy at the prospect of having them gone, she says. Cancer had torn. After she made her decision, Bowles felt relief. She went online. The evidence was there for her viewing. Photos of women. Becky Fitz was one of them. She says she estimates the tissue under her right arm could fill an A cup and the left side could fill closer to a B. It's so bad that she can't sleep on her side or even lower her arms completely. I have a funny shape. According to Fitz, when she asked her surgeon what happened, he explained that he was worried she would change her mind and want to reconstruct later. I am told that, after reading stories like Fitz's, Bowles was determined to make sure her doctor respected her wishes to go flat. She messaged women. When I met with my surgeon, I told him that I had seen other women left with skin to facilitate reconstruction and that I couldn't live like that, Bowles says. I didn't want to be. She chuckles at the memory of her husband pulling her aside and telling her, enough already. I think he gets it. To state what should be obvious, you do not have to have boobs to be a woman. But experts say, and they're not always subtle about it either. Women who have there's a notion that surgeons know best, Sulik says. And many of those but it's not just misogyny bleeding into medicine. The majority of breast cancer surgery in the United States is done by general surgeons with no specialty training on how to handle breast disease, in the Journal of Clinical Oncology. The study pointed, breast.
Raindrop, drop top, smoking, no cooking the hot pot. Fucking on your bitch, yeah, that. Looking up, open the park.